This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Hi everyone. So my name is Paul. I'm a fourth year resident at Albany Med. My co-chief resident, Crystal, is on the call, but she's having some technical difficulties. So we'll try and see if she can chime in a little bit later. But I've got, let me see. Just getting the share screen thing going. We'll get the PowerPoint going in just a second. Can everybody see this?
Yep, thanks, Paul.
Okay, awesome. Whoops. Okay, let's get back into it. Okay, one more time. Everybody good?
Yep.
Okay, awesome. So Albany Med, it's a awesome program. Just obviously, I'm biased. It's a fairly small program. This is just some of our initial faculty that we work with. The first 5 that you see here are all faculty at Albany Med proper. And then the 6th one, Dr. Sanajeri, is the medical director at Sunnyview Rehab Hospital. And we'll get into a little bit of that in just a second. Other faculty and instructors, you can see we work with a lot of the attending physicians at Sunnyview. We do EMGs at the VA. There are other doctors in the community who are affiliated with Albany Med who we have plenty of opportunities to rotate with. And then we do have a lot of certified prosthetists and orthotics professionals, basically, who we work with in the community as well. So actually, if you compare, the list of faculty to the list of residents, we're outnumbered significantly by faculty. We're one of the smallest residencies in the country, and that we really only admit 2 residents per class. What that means is a couple of things for me anyway. It's a very, very tight-knit community among us, the residents. We're all really friendly with each other. We all look out for each other. Call shifts, swapping out, everything like that is really easy because, again, we're all just friendly with each other. We want what's best for each other. And then the other benefit is essentially no matter what you're doing, whether it's inpatient, outpatient, you're having one-on-one time with an attending. You might have a med student with you, something like that, but it's really just at all times you're working one-on-one with an attending, and all of our attendings are eager to teach. They have a wealth of knowledge. It's a really fantastic situation. So a little bit about the hospital. Albany Med is basically one of the largest hospitals in the area, 734 beds. It is a level 1 trauma center. We had got a tremendous amount of reach. Basically, we're very conveniently located kind of very close to major cities like Boston, like New York, like Philadelphia. But we're basically pulling in from all of those areas, lots of traumas. You really see a little bit of everything, particularly in your intern year. If you're interested in pathology, you'll see a lot during your intern year. And just as once you actually get into your PM&R years, you'll see everything, obviously your big things, your strokes, your TBIs, your spinal cord injuries, but you'll see rare neurologic things as well. We do see a good amount of Guillain-Barré, stuff like that, CIDP, the list goes on. Albany, from what I heard about Pittsburgh, kind of sounds similar in that you do kind of get like a little bit of a city feel. It's obviously a lot smaller, but then again, you could drive out in any direction. You're in the woods. There's, things to do outside. There's skiing in the area. Like I said, it's pretty centrally located, easy to get to Boston, easy to get to New York, easy to get to Philadelphia, things like that. Easy to get to Montreal. It's a beautiful area. I went to med school in Albany, and I fell in love with the area, so I was thrilled to stay for my residency. Salaries are pretty competitive, especially compared to the cost of living. So that's an example. This is as of 2022. This is the most updated numbers. You'll find the cost of living in Albany is really compelling. As an example, I live in a 3-bedroom apartment and I pay about $1,900 a month. That's with, central air, beautiful location, walking distance to the hospital. All the residents kind of live all over the place, but we've found that, wherever you live, pretty much you can find really affordable housing and still have, enough left over to, have fun on your free time, which is also pretty ample. Some of the benefits as well, I won't run through all of them individually, but there's free parking. The meal allowance is proportional to on-call time. So what this means is that during your intern year, when you're on call all the time, pretty much all of your meals are going to be free at the hospital. As you transition to a PGY2 year, because we don't take call at Albany Med, we'll get to that in a second. They don't put a ton on there, but it's enough at least for a couple of weeks of free lunches. Then if you get your standard insurances, pension plan, 403b. So we are a 4-year categorical program. So the, intern year medicine is baked right in there. So it's going to be 12 months of internal medicine with a solid amount of elective time, especially for one of these programs. A lot of prelim years, they work the prelims hard, knowing they're not going to be there past that initial year. So they work them hard. You don't get a lot of elective. Here, I think we get anywhere between 12 to 16 weeks of elective time. And you can do 4 of those years in PM&R. You can also do kind of PM&R adjacent electives, things like rheumatology, sports medicine. So I really thought that was a pretty good PGY 1 year. PGY 2, we do 10 months of our, we do pretty much all of our inpatient rehab at Sunnyview Rehab Center. So it's about a half-hour drive from Albany Med. It's one of the top, actually, I think US News just ranked it like the 27th rehab hospital in the country. One of the top rehab hospitals, really, really good opportunities there. You basically spend time, months at a time, learning exclusively about stroke, learning exclusively about spinal cord, learning exclusively about TBI. Those are kind of like the big 3 that they do over there. And you'll see amputees as well. You'll see neurologic things as well. But it's really cool to kind of have everything kind of blocked off in that way that you can really focus in on a couple of things at a time instead of just having everything thrown at you at once. As a PGY 3, you will have 2 months back at Sunnyview, so that completes your kind of 12 months total. And then you can kind of see the rest of the things you do down this list. Something that's exciting is that as Sunnyview has expanded as a hospital over the last couple of years, they're getting a lot more into outpatient procedural things. So whereas I would have previously said that one of the weaknesses of our program is maybe not as much ultrasound, either diagnostic or interventional, that's now being corrected in that they've recently hired a bunch of new attendings who are really starting to expand their outpatient practice. And by the time you guys would come through, there would be a ton of opportunity for outpatient ultrasound injections, things like that. And then as a 4th year, very similar to the 3rd year, a little bit more on consults, but you've got time for elective, you've got time on prosthetics and orthotics, you've got time on EMG. We easily hit our EMG numbers usually by the end of our 3rd year or the very beginning of our 4th year. We also do more Botox, I think, than almost any other program in the country as far as chemodenervation goes. And you'll see that ultrasound guided, stim guided, EMG guided. It's kind of one of our specialties. The call schedule, pretty compelling. Every year, you take fewer and fewer weeks call. The call goes Thursday to Wednesday, as it says. When you are during the week, you take outpatient call only. And I would say that on average, I field 1 to 2 calls per call shift. And I don't think I've ever gotten one past like 9 p.m. They're pretty straightforward, the solutions for them. So very low stress. On the weekend of your call shift, you will go to Sunnyview from roughly 8 to 4 on Saturday, 8 to 3 on Sunday. Essentially, you're there to check in with the nursing stations, make sure they don't need anything, and help with admissions. You're not rounding, you're not doing progress notes. You're basically just there to, basically carry a phone with you, put out any fires that come up, and help with admissions. If there are ever any emergencies, Sunnyview is connected to Ellis Hospital via a tunnel, and emergency personnel can be there within seconds of a code blue being called. You're really never on your own in a situation like that. And if there's anything you're worried about that you can't manage medically, you're also free to send that person out for a higher level of care. A little bit about Sunnyview. It's a 115-bed hospital. Like I said, about half an hour from Albany Med. Really cool stuff they've got going over there. Really cutting edge things as far as robotics, electronics, STEM. You'll see everything there as far as what the modalities they have there. In the interest of making sure that we can get to the end of this and get to some questions, I'll just kind of leave this here. If you want to look through this PowerPoint in more in depth, I think it should be accessible to you guys. Just some examples of the modalities they have going at Sunnyview. And they do take pediatric patients at Sunnyview. Another thing I would say is maybe something our program hasn't been as good at in the past is getting inpatient pediatrics, but you will see some of it at Sunnyview. And inpatient rehab, you'll do some of it also at Albany Med. It's a much smaller facility, but we really just round as a consult service. So you're dealing with the rehab issues, any medical issues, or anything you don't feel like you want to manage yourself. There's a medicine team that is the primary team on that floor. EMGs, we get a ton of them done, like I said, and you're always working one-on-one with a lot of very qualified electrodiagnosticians. We do EMGs at the prison nearby as well. And then we do rotate with neurologists for kind of a different, everybody kind of does something a little bit different. You can find what works for you. And then we do have some, as we prepare for the EMG in-service exam, we have didactic sessions exclusively for EMG. And like I said, we really don't have any trouble hitting our numbers. A lot of residents exceed those numbers significantly, and we do pretty well as far as the EMGs. Botox, I already mentioned this earlier, but we do so many of these. You really feel prepared to go straight into practice and do Botox for spasticity, and we also get trained for migraine Botox as well. EMG guided, ultrasound guided. You really feel prepared coming out of practice and ready to start your own practice. Musculoskeletal ultrasound, we have dedicated didactic times for this. We actually had one today on shoulder MSK. And there's basically a curriculum that once every couple of months we will go, and we have standardized patients, and we will really hone in on all the major kind of joints, learning not only diagnostic, but also procedural. And like I said, there will be opportunities at Sunnyview as they kind of build out their outpatient clinic. As far as didactics, oh, and this is still for MSK ultrasound. I mentioned this already. And we also do have a cadaver lab where we can do injections for upper lower extremity joint injections. This is one of the sessions similar to what we had going today. We also have opportunities to rotate at the spine center. So you should have no trouble, hitting the numbers as far as the spine injections go. And a lot of different opportunities, whether you're on elective or whether you're on selective, a lot of different kind of satellite offices, all places that we have an opportunity to practice and really see whatever we want to get stronger at. Didactics wise, we have protected time every Wednesday, 1 to 4 p.m. We really stick to, your classic review books, things like that. And then there's also a journal club and physical exam lectures as well. The attendings come to these things, so they kind of, are able to help us out, but it's really resident run predominantly. Once a month now, the first Wednesday of every month, we also go to Sunnyview to have their attendings who are, again, very, very eager to teach. They do the lectures on Wednesday afternoons. We have a sim center that's pretty much state of the art. It's where we do our, ultrasound things, our ultrasound labs. Yeah, and then like I already mentioned, the cadaver lab is also a helpful resource. Some extra things, we do get $800 of money through GME for, books, anything educational. The department will pay for the Kessler PM&R board review course at the end of the year, and they will pay for you to attend the AA PM&R annual assembly. This says for PGY4s. In the past, if you're presenting research, there might be a way for them to actually get you over there, even if you're not a PGY4. This is just a snapshot of the current research we've got going. I know that Crystal has a couple of things going on right now. This is just the active research. We all have stuff. Crystal and I both presented posters virtually at AAPM&R last year. I'm presenting a case report this year at AAPM&R. A couple of our PGY3s also have things accepted at AAPM&R. I think already our PGY2s have projects that they're working on. The attendings at Sunnyview are all extremely motivated to get research done. All you really need to do is ask, and they'll be happy to include you. And it's a whole host of topics as well. And any of the thank you. Any of the other specialties in the hospital are also happy to kind of collaborate with you. And after residency, there is, as far as fellowship opportunities, there's currently one at Albany Med in Payne, and actually Sunnyview are very close to, they're working on getting their own TBI fellowship going, which is still new, nothing confirmed or anything, but I think by the time any of you would start here, that would probably be in the works. I think that's all I've got for you, so we've got time for questions. Okay, I don't know if Crystal was ever able to make it on, so.
I'm here. Can you guys hear me? Yeah, sorry, I was having some technical difficulties, but my name's Crystal, one of the other chief residents. So let me see what the first question is. For the small program size, for example, this is allowed to be flexible with the scheduling of rotations and electives. Yep. So our small program size is actually quite nice. You get a lot of one-on-one, and it does give you a lot of flexibility. So you are able to pretty much do almost anything as long as someone else is not on the same rotation. But there's also a lot of flexibility. And there's certain things that are designated for each section, but also they're very flexible with us. So like if there was something really cool going on with another attending who's another offsite, as long as no one else is on it, Dr. Huss will definitely let you do that as well. So a lot of flexibility. Even with vacations, everything is very flexible. Let's see, any other questions?
I can speak a little bit to that last one also very quickly. Just that, for example, I did an EMG like a month or so ago. I saw a patient in clinic with one of our attendings, Dr. Lestrito, and she recommended basically at the end that he should get an EMG. He seemed to have a really interesting pathology potentially brewing. I'm on a prosthetics and orthotics rotation this month, and Dr. Lestrito emailed me yesterday just saying, hey, by the way, that patient is scheduled for next week for an EMG. So if you're able to get out of your responsibilities and come help me with that, because I knew you were interested. And everybody I've like asked is like, oh yeah, totally go do that. Like, because that sounds really interesting. So yeah, it's cool.
And also in general, not only just rotations, but like family life too. Like I have a daughter who's about 11 months. So I was pregnant during residency. Everyone was like super supportive during my maternity leave, like modifying the schedule so that's easier for me. And if I have to leave like a little bit earlier because I got to get to a doctor's appointment for my daughter, everyone is very, very accommodating. So not only just scheduling like rotations for your career, but also very accommodating for just your general personal and family life as well. Any other questions, guys?
Looks like there's a one. Have we interviewed or accepted IMGs in the past and other opportunities for audition rotations? I think we have. I think we do interview IMGs. I can't remember the chief residents that we've had over the years have not been, but I know we have in the past.
Yeah,
as far
there
as
was
opportunities for, sorry, go ahead, Crystal.
Oh no, I was saying we did have we did have an applicant who was who had not graduated from an American medical school, and he did rotate like 2 months with us, but he didn't end up matching here. But we do have people rotate with us as well.
Okay.
Another one. Can you think on a personal mentorship relationship you have at the program and how they contributed to your growth? Okay, so we have a question from Kevin Shin about mentorship. So we actually have a pretty big mentorship in general. So there's a lot of attendings who are very willing to be your mentors. Dr. Diaz-Segarra is a new attending, and she's really into research. And she's also really into mentoring. In addition, I'm also a mentor for one of the programs at Albany Med. And I will be also starting or trying to start a new mentor program with the PM&R Medical School group at Albany Med. And one of my mentors is actually on the chat right now. And she had this wonderful research idea. I've been mentoring her, and that's actually one of the projects that we're working on now. I'm planning to get a poster published for her. And that has all kind of definitely helped her grow, but also for me, working with Dr. Diaz-Segarra has been amazing. I'm applying for a cancer rehab fellowship. And then once my attending found out, she basically was like, I have this amazing cancer research project. And that's not on the presentation, but that's something that I'm gonna be starting. And she basically started that to kind of help with my career. So she's also advancing my career as well. So lots of good mentoring. And we're also gonna be growing that as well with the med students. And then the next one, our 4th year is going to be virtual or they're in person. So the current 4th year medical students, the ones that are Albany Med, they have been coming in person and in cycle currently with us. And in terms of medical students who are not from Albany Med, I believe you can also rotate here if your program does not have PM&R. And when that happened last year during the pandemic, we did have an away medical student, and that away medical student did rotate with us in person. You mentioned peds being more of a weakness of your program. If I was interested in peds, how could I get experience in that area, Albany? So before I decided to do cancer rehab, I actually was also very interested in pediatrics. So I know we had said peds is more of one of our weaker spots, but it has definitely been expanding. One of the new attendings that we just hired last year, he had done a ton of peds. He comes from Columbia, which pretty much they do tons of peds, inpatient and outpatient. So he's expanding our inpatient pediatrics. So if you wanted to do more peds, you could basically ask to do rotations at Sunnyview and work with Dr. Irby. In addition, even before this, we always had tons of outpatient peds. The only part that was a little bit weak was inpatient, which we're currently working on. In addition, if you want to work with pediatrics, just general pediatrics, or anyone like pediatric neurology, pediatric room, anyone that has an overlap with PM&R, you definitely can do those like on your elective and selective time, or in a different rotation. If it's a really good opportunity, Dr. Huss will definitely let you be able to do that, which is what I kind of did whenever they had a pediatric consult or whenever there was something else going on. I always seeked out that opportunity. And basically Dr. Huss, even if I was not on consults, she would reach out to me and be like, hey, I know you're interested in peds. If you want to do this consult, you can come up with me. So if you're interested in it, because our program is really small, you can get the opportunity to do it. You just have to seek it out. And if you need guidance, obviously all your seniors will be here to help guide you for that as well.
Awesome. So Crystal and Paul, if you want to leave your emails, so the applicants can send you some follow-up questions. Otherwise, everyone, thank you for joining us tonight for PM&R Scholars Virtual Residency Fair. Stay tuned on Thursday, August 4th for a couple California schools and University of Washington. Everyone have a good night.
Thanks. Appreciate it.